Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. You know, weighing the pros and cons of applying to medical school can sometimes be overwhelming. Well, not sometimes. It probably is always overwhelming. I'm not a healthcare professional myself, but in studio with me is a healthcare professional, Dr. Sylvia Morris, certified by the American Board of Internal Medicine and the American Board of Integrative Holistic Medicine. And most recently, she was medical director for CVS Minute Clinic and an assistant professor of medicine at the Emory University School of Medicine. And she's with us today to talk about the need for doctors in the future and where she sees the medical profession going. Welcome to the program, Dr. Morris.
Thank you. Great to be here.
Thank you. You know, we do have a need for doctors. As a patient, I've seen that in that, you know, you get to see your physician for maybe 8 minutes and that's it. Sometimes I think, wow, if they had more doctors, you know, I know that there's meaningful use issues and all these other things, but, you know, to the layperson, it just seems like we don't have enough doctors. Is that something that I see as a patient, or is it something that is a reality in the medical profession?
It is definitely a reality. You know, the U.S., there is a doctor shortage. There's a projection that by 2025, there'll be a shortage of somewhere between 45 and 90,000 physicians. So that means that we really do need to train more physicians and have more physicians in the United States.
Do you think that training them to be more diverse in their thinking, more flexible as they get into medical school and realize that a lot of it is nothing like they were taught? I mean, you know, on-the-job training is one thing. I'm sure it's like in any other profession. You've got your tech school, but then you've got the real world on-the-job training. I've heard of a lot of physicians just going into another profession altogether.
Well, you know, certainly when we think about the training of physicians, we want everyone to be kind of culturally competent. And what that does is that helps to improve both accessibility and effectiveness for healthcare services for all people, for all Americans, irrespective of geographic location or race or ethnicity. Do
you think that diversity plays a part in the lack of physicians that are needed?
Well, you know, that's a great question. I think that certainly we know that the number of physicians of color, whether that be Latino, Native American, African American, is not reflective of the population at large. And that kind of given that there's sometimes the kind of instinctual cultural bias and all of the other things that play a role into healthcare and the disparities between health outcomes between white and non-white population, it's all sort of in the mix.
In the late 70s, early 80s, coming from a very small town, it was very easy to see a new doctor come to town. And it seemed that medical students coming in from other countries. Do you think that there's a lack of doctors, or is it a lack of American doctors?
Well, in the United States, certainly there is a doctor shortage. I think what you were speaking to is, are there enough doctors in the right location? Yes. Certainly we know that there are lots of physicians in major metropolitan areas. But in rural communities, and even within sort of poorer communities within cities, there are definitely pockets where there is not adequate primary care physicians to take care of the surrounding population.
Do you think that some of the physicians here that are already, you know, practicing may have such a financial agenda that they gravitate toward, I guess, the better paying populations and sometimes disregard those populations who may need the care even more?
Well, I really encourage medical students who talk to me about what specialty they'd like to go into for them to do the thing that calls them. So certainly there are people who are interested in radiology or dermatology. There are people like myself who wanted to be internists, who do hospital medicine. So there is a really wide variety of specialties, and there's a variety of places in which you practice. It is true that the cost of medical school continues to rise and that the average student loan debt for a medical school graduate is a little bit more than $200,000. So I'm going to say that again, $200,000. So, that's just medical school. That doesn't also include people who have debt, undergraduate debt from, going to college. So that there are real financial considerations that everyone must have. But I think at the end of the day, when you decide that you're going to become a physician, it is still about being in service to the patients that you care for.
And that's great. But there are three aspects of the healthcare profession that over the last couple of years, and speaking with healthcare professionals, one of which being meaningful use, the Affordable Health Care Act overall, and the sweeping changes that are coming in how physicians are being paid. Which one of those three do you think, based on your experience, is the most prohibitive aspect when it comes to deciding to be a doctor or remaining a doctor?
First, medicine it's such a privilege to be a doctor. Mm-hmm. Every time the opportunity to work with a patient and helping them feel better, helping their families become healthier, it's really such a great opportunity. And yes, there are lots of changes in medicine, which is not unlike any other profession where we are required to be lifelong learners, mm-hmm. And to continue to respond to the environment around us, and also the technological advancements, certainly our ability to diagnose and treat diseases, has changed and really improved. And then if we look at the number of new medications that come out, so all of this is sort of in the forefront of how we practice medicine. And then, yes, reimbursement. So if we're talking about value-based purchasing or healthcare readmissions reductions programs, mm-hmm. or hospital-acquired conditions, all of those things are certainly being looked at. There is an emphasis by CMS, so the Center for Medicare and Medicaid Services, mm-hmm. which is the biggest payer, on quality of care and not quantity of care. So we want to encourage healthier communities. And how do we do that? Mm-hmm. By sharing information between entities, so whether that is through an accountable care organization or an ACO, or it is between individual physician offices or hospitals. How do we do that? We do that with exchanging data, which there's a lot of data in which to do things with, via healthcare IT. So yes, electronic medical records, much like you and I'm speaking on my cell phone, my mm-hmm. smartphone. Mm-hmm. I can do lots of wonderful things through my smartphone. In addition to looking at patient charts, yeah. I can also find out, pharmaceutical information. So the world is changing. Mm-hmm. So that means that individual physicians must also pivot and understand that there will be some changes that will be a little bit rockier. Mm-hmm. But then there will be other opportunities that really do positively impact our communities.
Having worked as a hospitalist, where do you see the future of the hospitalist as that position attempts to bring all of these aspects together to have better patient outcomes?
Yeah, hospital medicine is a really relatively new specialty. When we think of sort of all the specialties in medicine, I think the group organized sometime in the late 90s, 1998. Mm-hmm. So we're going into somewhere around the 20th year of hospital medicine as an organized specialty. Mm-hmm. We certainly are in the front lines of what we call acute care, meaning so that when patients are admitted to the hospital, overwhelmingly now they are taken care of by physicians who only work in an acute care setting. That means that they are there and can be responsive to sort of the immediate needs of the patients rather. Certainly there are still physicians that work in an office and then come to the hospital as well. But I really think that the way that technology is impacting the care of patients for the betterment, all of the scientific advancements, that hospital medicine is here to stay. And it is, again, just another opportunity in which to provide the highest quality of care for patients.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard, talking with Dr. Sylvia Morris. We've been talking about the need for doctors in the future and how she sees the medical profession progressing in the future to provide better patient outcomes. It's been a pleasure talking with you, Dr. Morris.
My pleasure. Thank you very much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can also subscribe to this podcast on iTunes.